gonna shut it off now. Hey guys, welcome back to my channel. So for today's video, I wanted to go ahead and talk to you a little bit about something I've been doing for a few months now off camera, and that is getting my master's degree. So for those who don't know, I am currently a registered nurse working in Houston, Texas, but I am also going back to get my master's degree. Right now I have my Bachelor's of Science in Nursing, but my goal is to become a nurse practitioner away from the bedside, more on the provider role, so that I can help kind of with diagnosing, following you throughout your health and journey, and kind of helping with that in that capacity, which is not something that you can do as a bedside nurse. You're more just kind of looking at orders that come in from the provider, using your nursing judgment to maybe like put oxygen on a patient if they need oxygen, but usually those orders are already there from the provider, and then it kind of becomes your responsibility to look at the patient, assess the patient, and then use your judgment. So that's the biggest difference between what I'm doing now and what I'm going to school to do. So I kind of wanted to talk about that a little bit for anyone who's also interested in following that path. So the program I'm in is about 2.5 years long. I started over the summer, so I haven't been doing it too long, but the way that it's set up, I'm currently in my second and third class this semester. So it's a 2.5 year program from start to finish. It is for my master's degree as a family nurse practitioner. I decided to go with the family nurse practitioner because I really enjoy seeing people from kind of like start to finish. So this gives me an opportunity to see you from like a child or a baby or an infant, and then really grow with you throughout your lifetime. And one thing that I, as a person, as an individual outside of healthcare, have really enjoyed is the fact that I have a nurse practitioner, not a doctor, but a nurse practitioner that I have been seeing regularly. And it's given me comfort to be able to confide in one person who really can have a vast knowledge of a lot of symptoms. And then also, if they don't, like if it's something like a specialist per se would really need to focus in on, they can also provide me with the resources in my area to go see a specialist for whatever maybe my issue may be. So I kind of wanted that to bleed into what I do, and as a nurse you really have so many options, and so it was just common sense for me to go this route, especially with kids of my own. I felt like being a nurse practitioner would give me that opportunity to create kind of the schedule that I'd like and do it that route. So the program that I'm in is 2.5 years long. It is 100% online, which obviously like that's number one right there. I needed something that was 100% online. I didn't have to like go up to a campus, because in my undergrad for my bachelor's degree, I was going to the campus like 2 to 3 times a week, which is already a little bit less than a traditional bachelor's degree, but that was still demanding. For me, working full-time, being a mom, and having to do that as well, it was overwhelming. So now I have the opportunity to work 100% online, doing my work and viewing my lectures, and I really, really like that, especially because work is so demanding still. Being in a nurse residency program and being new to nursing in general, there are so many people like coming at you from different directions. Join this. Download this app, do this. It's like, it's overwhelming. It's a lot. And I'm like at the point where I'm like, no, I'm not downloading any more apps. I'm not joining this group. Okay, I will see you when I see you. Like, that's literally where I'm at, because there's just so much going on that you have to like take a step back for your mental health. So I really enjoy that this program is 100% online. Everything is opened up to you from the start as far as each class. So when you start the class, you can literally see from day one to the final day what's due, when it's due, and it kind of gives you a chance to plan your schedule, your school schedule, so that you can succeed. And so I think that something that's really important for this type of learning is that you have to be an autocratic learner. You have to motivate yourself, and not everybody is like that. And so I don't think that it's good for everyone. But one thing that I noticed for myself, especially even in my undergrad and my prereqs before I started nursing, I did the best in classes where I did not have to have a teacher teaching me. I don't know why. I think that the way I learn is just very independent, and I think that that's that's just why I did so well. I honestly will tell you, I took statistics 3 times. I tried to take it the first 2 times with a teacher. I stopped going and I failed. I took it the 3rd time on my own, online, 100%. All I had to do was go up to the school once a month for the proctored exams in their computer lab, and I aced statistics on my own. So I feel like it wasn't the material, it was the teacher. And I remember specifically being in that class one of the times, and the teacher looked at me when I asked a question and asked me, "Oh, you don't know this?" And I'm like, no, I don't know this. Like, that's literally why I'm in this class right now. That's why I'm learning, because I don't know this information. If I knew it, I would have just taken a test to test out of this class instead of wasting my time. Obviously, I don't know it. So that just really didn't sit well with me, and I tend to learn better on my own. That is the type of person that I am. And so for me, I want to take advantage of that opportunity to do well in the style that I do best in, which is aristocratically, or autocratically, sorry. So the program is 2.5 years long. So the way this program is set up is that each of my classes, I have about 14 classes in total to take for this particular degree, and each class is about 5 weeks long. There are 2 classes, specifically advanced pathophysiology and pharmacology, which are 11 weeks long. Obviously, because those are the meatier classes. Like, there is so much information. It almost is like 11 weeks isn't enough time, but it really, like, you get it all. And it's just so much information that you literally have already learned from nursing in your undergrad, but now you're applying it as a provider. So now you know all of this information, like for advanced patho, you know all of this information about disease processes, but now you're looking at it at an even grander scale under a microscope. And then you're also now deciding, what are you as the provider, as the nurse practitioner, going to do? So as a nurse at the bedside, you may know that your patient has diabetes, and you see the orders from the doctor to give them their insulin scheduled, or maybe if they need, like, just to be covered if it's going to be high after lunch or something like that, you know, because you have those orders. As a provider, as a nurse practitioner, you are putting those orders in. So you are now saying, all right, we're going to cover this, we're going to do this. That's the biggest difference in what I'm doing now and what I'm preparing to do. So those classes are a lot more difficult because there's so much more information to try and stick into 11 weeks. So it really is a process. And then obviously pharmacology is all medications. There are so many medications for so many different things. There are so many medications for the same thing, and knowing, hey, when am I going to give this to a patient versus when am I going to give this to a patient? Does this disease process contraindicate why I would not give this medication to them? So you have to know that, and that's why you really need to get a good understanding of the pathophysiology and your pharmacology. Like I said, most of my other classes are 5 weeks long, and then there are like 2 or 3 classes that are only 3 weeks long, and those are like my assessment classes, which really, it doesn't take long. We've all done assessments. I'm a nurse now, so I'm still doing assessments. So by that point, they feel like you should probably have a good understanding of how to assess a patient, so they don't spend entirely too much time on it, which is really nice. And it's just, yeah, so my first class that I took was a research class, and it was a lot of paperwork on nursing and just kind of like the fundamental, like, why am I a nurse? What am I going to be doing as the nurse practitioner? And evidence-based practice that supports that information. It was a paper every week for 5 weeks. There were tests. It was really nice, but it was very still busy work, a lot of work to do. And then I still have to, mind you, have my full-time job as a nurse at the medical center and taking care of my kids and homeschooling. So it's a lot, it is a lot, but it's a challenge that I decided to take on because I already know from the start, I already knew that I did not want to be just a bedside nurse. Nothing against bedside nurses, but if you have a plan, why wait, is kind of my thought process. So right now I am currently taking pathophysiology. I am more than halfway through the course. So the way it's set up specifically for this course is that I look at my assignments that are due for the week. I try to do them as early as possible, and then I try to look at my lectures. So there are no set lectures, which differs by school. So some schools will tell you need to log in at this day, at this time, this is when the lecture is going to be open. My professor has the lectures open all the time. So you really do get to learn at your own pace, and you want to take advantage of that. The biggest downside is procrastination, because if you procrastinate, you're not going to do well. You're going to literally wait till the end to watch your lectures, which I've done, and then find yourself having to remember information that you would have retained better had you watched those lectures 2 weeks ago instead of yesterday. So in that respects, it is really just up to you to own your learning. My professor is there for me when I need them to ask questions, but it's really up to you, and that's what I'm learning about this program, which I'm really loving. So basically how tests work is, like, for instance, this week a test is open. It opens on Monday, it closes on Saturday. You literally have between Monday and Saturday, pick your day. What day do you want to take your test? You start the test. It's usually you have about 90 minutes or so to take the test. It's about 50 questions long, and they're very hard questions. They're not like simple nursing questions. That is, I will reiterate that, it is not simple nursing questions. So if you think it's gonna be like your undergrad, it is very, very different. And that's all I'm gonna say about that. So yeah, that's pretty much how the testing goes. Once you start the test, you cannot stop it. You have to finish it once you start it. So pick a day that really is going to work well for you. Pick a room that is really going to work well for you. And because everything is 100% online, I also have to pick a camera and a spot that I'm going to be video recorded on that's going to work well for me as well. So I have to have my driver's license present. Before I start the test, it asks me to test my camera out, test my microphone out, and then show a picture of my ID. So I need to have all of those things ready for my test. It can be a little bit nerve-wracking, especially if it's your first time taking a test where you're just like, boom, there's a camera there, and it's also looking at your computer screen to make sure there's no cheating going on. Your table is visible to make sure there's no papers on your table. For our class, we have to do like a complete 360 of the room that we're in before we start. So we have to literally start from one wall, go all the way around, show them everything that's around us, and then end back at that same spot. If our face moves out of camera frame or our computer moves out of frame, then you will get an alert on your test that you have moved out of frame and you need to go back into frame, and you run the risk of possibly failing that exam simply because you are out of frame. If your ID, your identification card, is blurry or out of frame, which is very easy if you're using a webcam that's like not the best quality. A lot of times, like, I have to play with my ID to make it look good on the computer webcam, so that kind of sucks. You can't use your in-computer webcam. So like, I have a webcam that's already built into my Mac. I can't use that. I had to go buy like a really cheap webcam that I could just plug into the side. Like, it was the most, but whatever. So you have to keep all of that in mind, that you are going to have these other type of stipulations just because everything is online. You submit your test like normal online. The teacher usually posts grades. It usually takes about a week, not gonna lie. It's kind of annoying, but it is what it is. And then you have smaller like assignments within that week, maybe like a discussion board that's due, and then there's usually a case study that's due every 2 weeks, and you basically get a patient. There's a set of questions. You get the vital signs for that patient, a background of that patient, and you really have to basically tell the professor, what is this diagnosis based on everything you've heard? Why do you think it's this diagnosis? And then everything, of course, is backed up by resources that you cite within the paper, within your whatever kind of format that the professor wants. So you have to still use resources and cite them and use correct APA format. So it's still like a normal school, but the fact that I don't have to go up to a campus is what makes it 100% more doable for me. Like, I don't have to go up to a campus. I'm good. I'm fine with that. I'm happy. So that really is what changed the game for me. The information itself is not necessarily the hardest. There are some parts that are hard because I've never thought on that level that they want me to think on. But the information is pretty simple, but it's it's a lot. It can be overwhelming. So that's why I said it goes back to how you set up yourself in that class, because if you give yourself 2 weeks to really learn the information, sorry, that's my phone. If you give yourself 2 weeks to really learn the information, you're gonna learn it. You're gonna do way better than if you wait 3 days before a test to look over your lecture for the first time and then try to learn the information. The clinical aspect portion, so the school that I go to, you do all of your didactic book learning classes first, and then you do the clinicals towards the end. So the last like 6 months, I believe, of my program will be all clinicals. Yes, I've already started the process as far as like making sure my immunizations are up to date and submitting those through the program that they use. My flu shot is up to date every year. There's certain things that you have to do annually. And then securing your clinical site is probably the most important part of why someone will choose or not choose a school. Some schools will do it for you. They will provide a person whose sole job is just to find a clinical site for you to go to. My school is not one of those schools, I will say. So I'm banking on the fact that I work in healthcare and I work in a teaching hospital to really kind of push me through that process, because I do work with nurse practitioners and doctors who teach. It's a teaching hospital, so I've already started kind of scouting like some different locations and different people for that. I will say that if you can find 1 location or 2 locations that will really cover every, like family medicine, like if you can find maybe 1 ER. I know that the ER that I worked in before I started here in the medical center, there was a pediatric ER and an adult ER, and I worked both sides of that. See if you can utilize both sides of that for your peds and your adult side for the emergency, if you need emergency medicine, family nurse practitioner. A lot of the nurse practitioners I work with and have worked with in the past do both. They spend some time in a clinical setting and then they go to the hospital and they do rounds. So really utilizing them and being like, hey, I'm in nurse practitioner school. I'm getting my master's degree. I need this many hours in the family care side. Can I come and shadow you in the clinical aspect when you're not here in the hospital? Can I do that? And just asking that. So those are some of the things that you as the nurse practitioner student have to do on your side of things, depending on the school that you go to. That is something I have to do because my school, like I said, does not provide placement, clinical placement for its students. So yeah, you have to be proactive. Generally, you want to secure those relationships and those clinical sites as early as possible, because you do have to submit that information to your school. They have to be aware of where you're going to be. There's some signatures that need to be obtained and all of that kind of stuff that comes, legal matters, to actually make sure that yes, you are actually in a place that is going to give you the information and the required objectives that the school wants for this many hours, and so on and so on. So there's a lot that goes on behind the scenes as well. It can be overwhelming. So when you go into nurse practitioner school or getting your master's degree, you want to take all of that into consideration. I am doing that. I think it's a little bit more stressful, like I said, right now, because I am in a nurse residency program as a new grad nurse myself. And so I'm still learning all of this stuff that encompasses bedside nursing. And then I'm also homeschooling my children and trying to have a life. So I'm doing a lot of things that just make me happy, genuinely make me happy. And I don't think I need to sacrifice that anymore, because I did that for 3.5 years in my undergrad. I don't want to do it anymore. I think I found the best way not to have to do that too bad by choosing this program. So if you're interested in nursing or going back for your master's degree, do it. I mean, honestly, it doesn't matter how old you are. It's definitely something that you can do. Yeah, so that's just my take on it. Thank you guys for watching, and I look forward to seeing you in my next video. Bye, guys.